Hello, world. I am Katie Walker, the CEO of Revitalist Lifestyle and Wellness, and today I am speaking about ketamine and addiction. I'm going to talk about addiction and particularly as to how we don't really know too much about it and how the world is becoming addicted to everything, right? So what is addiction? Addiction is the inability to control, right? To where we are putting a lot of our actions onto an object or a situation. So addiction can be too much work. It can be drugs, it can be sex, it can be shopping, it can be eating. Really, if you think about it, probably one of us have had some type of addiction in our lives at some time. And fortunately for a lot of us, we're able to break that consistent nature of cycling, but other times a lot of people cannot break that. So when they can't break that cycle, then the addiction continues to get worse to where it starts taking over their life and it starts duplicating what it knows to where the addiction is all we have and we destroy everything else around us. So it's very unfortunate. And then usually addiction sometimes can lead to death. So with addiction, what we're seeing is there's actually much more of a neurologic component to addiction. And ketamine infusions are allowing us, and injections are allowing us to actually address addiction in a very functional manner to where there's tangible aspects that we can identify. So if you go to traditional way of thinking for addiction, to where we say, oh, you're wired like an addict, that's personally a statement that I think is highly unethical. I think people who say, well, you know, you're an addict because the first time you hit something or you took a drink, you remembered where you were, right? And that's your wiring of an addict. Again, I think that's incorrect. I personally believe it's an emotional connection to an object. I believe that there was a suppressed emotion or emotion we didn't really know what to do with. And once we were able to make ourselves vulnerable to an object or a situation, it allowed our brain to address and give whatever substance it needed from a transmitter standpoint. If it needed more dopamine or serotonin or whatever else, or if it needed to even just mute down the anxieties. So most people who drink alcohol, a lot of it's functional anxiety. So alcohol, you know, you're so much braver when you've been drinking, typically. You know, but what we see is that level of anxiety, we're using alcohol as a medication. We're using cannabis as a medication. And cannabis is very effective for a lot of aspects, but what happens with cannabis is we'll start actually smoking more or taking more than what we need. And over time, you can get something called hyperemesis syndrome, which is this really, really bad stomach ache. And a lot of times we don't even know what it's coming from yet, I don't believe, but it can be addressed with a hot shower. It can help to take away some of the symptoms of that. But once that hot shower is gone, then the symptoms come back and people feel like they may have a bad gallbladder, a bad appendix, hernia, you know, different things like that, that aren't there, right? So that's the cannabis piece. But we start taking substances to decrease the symptoms of anxiety instead of actually effectively addressing them. So what our brain does over time is the structures of the network start getting changed to where a negative action may produce a positive reward. So if you go hit meth or heroin or alcohol, you may be compensating your brain feels better because it's able to give, you know, kind of this release of what it needs in the brain. But then you have that psychological shaming piece. So it's the same way with like people who eat for emotions, right? They may go eat a piece of cake after they have had a hard day, and then they eat the whole cake because they can't stop themselves. And then the next day they feel horrible because they did that and they really just couldn't stop. So what that is, what we're seeing is it's not necessarily a dopamine, serotonin, norepinephrine, epinephrine. It's not all those guys necessarily. Do they contribute to allowing us to be more objective to where we have more control over the structures? I believe they do, but I don't think they're the primary driver as to what everyone thinks that they are. So the structures that we're seeing that caused a lot of changes is something called your salience network, your central executive network, your default mode network. Your salience network is your ruminating thoughts, right? So what does rumination mean? It's a thought that keeps going around and around and around. I can't get off my mind. I can't stop it. And people are like, just drop it, just drop it. You literally can't sometimes because your salience network isn't strong enough to allow you to do that. So your salience network is something that we all need to strengthen. Everyone has one. We all have these. Your central executive network is a great network to where, how do we interpret data? When data comes in, how's it interpreted? What does it go into memories? Like all these different pieces, right? So we're not training ourselves on any of these networks that actually allow us to think properly. Instead, we're just medicating people when they're not thinking properly because we've never been trained to think properly. We just expect people are just going to think. And if they don't think correctly, they're dumb or they have low IQ. We're not training our brains, guys. We got to train our brains how to think. Like in medicine, nursing, first responders, veterans, they're all taught how to utilize critical thinking skills. It's a thought process that is learned and trained over time. And the only thing that we're doing is giving these people, here's math skills, here's science skills, here's English skills. It's great. We want them to do that. But they've got to know how to have a functioning network in order to interpret this data and actually execute it accordingly. So your central executive network is a great one to look at. And then with addiction specifically, it's your default mode network. So your default mode network is a positive action creates a positive reward. Negative action creates a negative reward. What happens sometimes with addiction is a negative action will create a positive reward. Or vice versa. Positive action will create a negative reward. It's almost like the brain gets flipped. It gets confused. So what ketamine allows in psychedelics, as you see, if you can, I don't know about other studies, but if you look at psilocybin with their levels of addiction, it allows the brain to disconnect from that, right? So you got here's your default mode, here's your addiction, and they're like this, and they're intertwined like a bowl full of spaghetti. And ketamine and psilocybin, other psychedelics, hopefully, allow this disconnection to where they become categories. So default mode, network, and addiction. And you get to look at these different pieces. You get to see what causes your cycling to make you use. Because a lot of times we just want to give you something to decrease the urge, right? Here's some Vivitrol. Here's some naltrexone. We just want to give you something to where you don't feel the urge, but we're not going to teach you how to effectively cope with using a negative coping mechanism and to replace it with something positive. We're going to tell you should get out and exercise. You need to figure out something to, like, once your addiction goes, you got all that space in your brain, and we need to put some more, different maneuvers in there. Go do yoga, go walk. Well, that's great and all, except we're not addressing what caused the addiction in the first place. And we may think it's because we were raped when we were little. We may think that it was this ACE scale, your adverse childhood experiences, to where if you have a 4 or higher, you're at higher risk for addiction and mental illness. So it may be significant events that happen to us along the way, but the fact of the matter is we've never effectively processed those, and we don't know how to. And then the coping mechanisms that we developed are ineffective. So let's talk about processing and ineffective coping mechanisms. So when we have significant events that happen, it could be anything, right? It could be trauma. It could be death of a loved one. It could be changing of school in the middle of the school year. It could be something that it could be COVID. Good gosh, COVID changed the balance of everyone, right? So when these things happen, our brain gets about 6 months of effective time to process these changes in our base. If our brain doesn't effectively process these different pieces, then what happens is we start having symptoms of anxiety and depression, to our brain starts living more so in the future with anxiety, in the past with depression, and it forgets about the present. So if we're truly living in the present moment, we do not have symptoms of anxiety and depression. And what happens with trauma is we take our past experiences and we put them on our neutral piece of present. And when that happens, we trigger and we react. So it's our subconscious protecting us. So unfortunately, a lot of times with addictions, we don't know what to do with our emotions. They scare us. We can't identify them. We're too sensitive. We're too emotional. And really, you're not. We just don't know what to do with them, right? So if you don't know what to do with your emotions, over time, they duplicate what they know and they get stronger. There's actually studies out there. Sorry, men, but there's studies out there that show men and women, they have the same emotions. It's the way we're trained. All right. So there's a lot more of training and emotional intelligence that we can have on our emotions instead of just looking at the structures and the physicality of it. Because what we do in mental health right now, we just look at the physicality. We try to figure out, are you serotonin deficient? Do you have too much dopamine? What's your norepinephrine doing? How do we block those? How do we allow the brain to increase all these different levels? And then you're going to be fine. But we're not training the brain on how to function, how to utilize these awesome networks that we have in our brain, how to have critical thinking skills, how to have internal self-coping mechanisms, how to have self-analytical skills. We're not teaching our brain any of this. We're sending you to a therapist to help process your past. So if your therapist is only helping you to process and they're not allowing you to build coping mechanisms for the future, you need to change therapists. So your therapist should also help be your coach. Because if we can get some of this stuff off of our plate in our brain, then we feel like we have room to actually process. So what happens with addiction is we get connected to an object. We get emotionally connected to an object. So what does that do? That starts disconnecting us from society. And then our brain duplicates what it knows. So everyone believes in muscle memory. Muscle memory, your muscles don't have memory. They're just fibers that contract and relax. But what they do have, what our brain does have, is it also has behavioral memory. So as we go through life, our brain picks up on weird stuff. It will pick up on horrible traumas, of course, because it doesn't want that. It wants to just survive should that situation happen again. But a lot of times we process the entire trauma. Our brain will hold on to what grounded us during that time. Because during bad situations, our brain goes to something that it focuses on until the situation's over. So sometimes it could be that it wasn't the whole bad situation that happened. It was your brain was stuck on a marker. Your brain was stuck on looking at the rug, right? But literally it like blocks, it stops. Your brain's like, ah. And if you think about it, what is that? That's called your sympathetic nervous system, which is your fight, flight, freeze. If you think about fighting, running away, and freezing, they're all three completely different. They're all three polarities of each other, completely opposites. But our brain will go to that when it needs to respond because it's given us the best opportunity to survive. Because a lot of times we should be fighting when we're supposed to freeze or running, but we're able to do that all of a sudden, right? So that's what sympathetic nervous system brain's like, so it allows us to survive that way. So when we get stuck in those levels of something, fighting, flighting, freezing, we don't resolve what caused our brain to get to that conflict in the first place, and the brain will start duplicating that piece. So you start becoming hypervigilant. You start feeling like your skin's crawling. And then we take substances to suppress that. So if we feel more depression, what do? We'll hit some cocaine or, something to actually make us higher. Or if we're up here all the time, then we're going to take alcohol and benzodiazepines and such to make it lower. So we're medicating ourselves, right, with uppers or downers. Interesting fact with cocaine, when you hit cocaine, your neurotransmitters aren't the same for at least 3 months, just with one hit. So your chances of using that drug over and over and over are very, very high. And it's only like a 0.3 second increase in blood flow from cocaine. So word of the wise, if you do cocaine and you go have surgery, Don't let I mean, they may cancel your case if you tell them, hopefully they won't, but just say, hey, I've hit cocaine within the last 3 months because where your transmitters are wrong or they're off, right? They're depleted. You will have chronic hypotension in the surgery. And the only way that you can treat it is with natural aspects. So all these drugs that we give, neosynephrine, Levophed, all this stuff that we actually give in the OR, it won't work for you. The only thing that really works for people who use cocaine in the operating room is epinephrine. It's the only thing that can get your blood pressure up because you're completely depleted. So anyway, a drug's a drug, right? Sex, shopping, they're all the same thing. We just judge people differently depending on what their substance of choice is. So we become emotionally connected to an object, period, end of discussion. And that emotional connection gets worse over time because the brain duplicates what it knows. And if you can't objectify the emotion, then you're in trouble unless we can break the cycle of addiction and teach you more positive mechanisms of action. So ketamine allows the brain to go into a neutral space. It disconnects that cycle of negativity with addiction. It allows you to breathe, to feel like you again. It allows that objectivity to come forward and the emotional piece to go back. And you don't feel that emotional connection to the object. You don't feel that urge. And does it happen with one infusion? Absolutely not. It happens in a brain training program. It needs to happen over like a period of 90 days to where you're not only doing ketamine, you're also doing intensive outpatient programs. You're looking at different aspects, not to how to control your mood or learn to live with it, but to objectively identify the analytical points on how to learn to live with yourself, learn to live with your brain, learn to walk with your brain. Your brain's not functioning abnormally. It's just functioning on the wrong path. So we got to take it back, come back. I know you're on level 15, but I need you to come back to level 1 and disconnect this. And we're going to start learning these new coping mechanisms along the way. And then we're going to get you to level 20, because if you're on level 15 over here, your next level may be death. And that's what we don't want to happen. Because every time you die, every time somebody acutely dies from something, especially addiction and such, it can get duplicated in their family networks. So you don't want to leave your kids, your family, your friends on this earth without you. You want to show them that you conquered something, so it doesn't duplicate in your family genetics, and it doesn't duplicate in that family cycling, with the environment and such. So when people say, well, ketamine's been used, people can get addicted to ketamine. People can get addicted to anything. Tide Pods, chalk. Look up pica. See what pica is. People get addicted to everything, right? It's not the substance, it's the brain that doesn't know how to control the substance. So ketamine, there's something in the early 90s used to be called Special K, still on the streets, Special K. It's being utilized in a capacity to where it's either a dose that's 1/300th of a strength, to where it just makes people feel like they're more relaxed, or it's being used in like a 300% increase to where they're utilizing more so as like a cocaine, like a stimulant, right? But ketamine, what we're seeing with the addiction piece, and we're seeing this from great universities, Johns Hopkins, Yale University, Oxford, everybody's having a lot of really good success, guys. It's the first time we've ever been able to neurologically look at the brain. But with this piece, what we're seeing is ketamine with the ketamine piece, you put it in that neutral space. When you put it in that neutral space, it allows that disconnection to where the brain can hear, you can hear. So personify your brain. You aren't your brain. Your brain's leading you. If you try to lead your brain, you're in trouble. We all are. We got to learn to work with it, not work against it. And we need to recognize too that our brain's amazing. It's not something that we're meant to suppress. It's something that we're meant to learn and to understand and to incorporate into building the forward future, right? So when ketamine's able to reset that, our default mode network also gets to reset to where then A positive action can create a positive reward, or a negative action can create a negative reward. And I'll tell you, a lot of people who have addictions, they have a very, very high level of intelligence, probably too high for most of the world around them. So they don't feel like they can connect with people. But then they can connect with an object on their level of. So it's it's just a negative thought process. It's a negative cycle. But there's a lot of hope for everyone who has any type of addiction. We all have to learn to regulate. We all have to learn to drop it. We all have to learn that when information comes in and we're interpreting it, are we interpreting it because it's what we've known from the past? Are we interpreting it based on a conceptual, evidence-based fashion as to what data states? Because it all needs to be data. And if the data is not there, then it's an emotional opinion as to what we're interpreting with the data. So 12 steps works great if you're able to hear what they're saying. And also 12 steps, a lot of people with the abstinence aspect, they look at ketamine's falling off the wagon. Ketamine is not falling off the wagon. Ketamine is a medical intervention that's causing your brain to reset itself. So if you look at taking ketamine as falling off the wagon, you can never have surgery again on anything, because we give you products that would make you fall off the wagon, but we're utilizing them in a controlled environment in a medical setting as a medical intervention. It's very, very different than if you go by yourself to snort cocaine or snort ketamine or whatever else. So you're not falling off the wagon. You're actually treating the underlying cause that caused the addiction in the first place, which is usually anxiety that's coupled with depression. So if you're currently living with an addiction of some sort and you feel like something's controlling you and you can't stop it, step back and advocate for yourself. Consider getting ketamine infusions. Recognize that you're a functional I'll say functional alcoholic, but it'll be the same thing for every other level of, piece that comes out, whether it's drugs or whatever else, because you're able to function in an altered state. So it's going to be a little bit harder for you with ketamine infusions because you've got to get to where your brain's leading you, not you're leading your brain in an altered state of consciousness. So ketamine is able to lower your consciousness, increase your subconscious to where you can analyze your subconscious as to why you're using. And honestly, when you're using, you stop increasing your emotional intelligence, because you stop having emotions when you're using a substance. Your emotions get connected to the object. So when you get clean and you start having emotions again, those emotions are going to scare you. They're going to scare you because it's the same emotions that you had previously before you started medicating them with whatever substance that you use. So when those emotions come up again, don't let them scare you. Learn to talk to someone to identify these. Once you can effectively identify them, which ketamine allows us to do very effectively, they start getting muted down to where you start feeling more objective and less emotional. And until you can identify that, you're never going to have control of your life. Your life's going to be emotionally led by an object, by substance, and you're never going to be able to reconnect with the people who actually allow you to have love and everything else, right? I mean, love and all the emotions, they're so powerful. But if we're scared to death of them and we're muting them, then we can't enjoy life. So I think every person out there who has some type of addiction needs to understand that now's the time to get the help that you need, because you deserve it. Everyone deserves it. So don't let people judge you. Don't take it to heart. They're all going to judge you, right? That's what we do in life. But with the addiction piece, try to recognize that there's more to addiction than what we're telling you. And just decreasing the urge by giving you Suboxone or Subutex or Narcan or Naltrexone or Vivitrol or whatever you want to do, but decreasing the urge, we think that we've won. We've not won. That's one step. Let's then try to increase your skill set to where you can understand the emotional piece again. You can start rebuilding emotions. You can start reintegrating them into your life, and you get your life back because you deserve it. So I highly advise you to look at ketamine infusions. Highly advise you to reach out to your insurance companies, to where your insurance companies should be covering these infusions. This has been going on. Ketamine's been given for the last 53 years. From an infusion capacity, it's been given for over the last 20 years. We have more data on ketamine that's unbiased across the world than any other pharmaceutical agent that's out there. So encourage your insurance company to cover this because the efficacy is about 80% or greater. And until that happens, we're asking people to pay out of pocket, and insurance companies will cover other pieces that aren't nearly as effective because of the political realm of it. So this time, customers of insurance companies, call your insurance company. You're their customer. It will save them millions of dollars a year. And look at getting help for addiction. Call ketamine clinics. Because it's not the addiction that's controlling your life. It's the underlying moods that you try to activate or deactivate with the substance or the object previously. So once we can identify those moods as to why the ineffective coping mechanisms or the negative coping mechanisms of utilizing the substance was there, that's when we seek peace, right? That's when we seek resolution. So advocate for yourself, advocate for your kids, advocate for your communities, and help us to push forward with this because we all deserve it. So thank you for listening. Should you have any questions, please put them below. I'm happy to answer. Should you disagree, please do. And let's just figure out how we can continue to open our mindsets so we can push forward.